Thank you everyone for being here. Can you hear me okay? All right, so I'm going to not use any slides. We'll keep it, I'll talk for about 15 or 20 minutes and then we'll make it interactive. But feel free to interrupt me in the middle too. I want to make it informal and as informative as we can, which means that we need to have a conversation. So I came here I put on my white coat because I want you to visualize something. Picture this. You go to your doctor's office, as many people do come to my office. They bring a plastic bag full of medicines. Often it's a Target bag or some other now cloth bag full of medicines. And they've already done some blood tests. And I see that their blood tests are high. Where I'm talking about hemoglobin A1C here because I'm specifically going to focus on diabetes. But this applies to so many other chronic diseases. And if you face it, most chronic disease is metabolic disease. So diabetes is a good model to study it. So they've had a blood test. It shows that their blood test is high. The doctor sits them down. We start pulling out pill bottles out of their Target bag. And they have, the whole counter is full of medicines that they're taking. And their numbers are high. And the doctor says, you know what? You need yet another medicine. Or we need to start you on some injectable insulin or these newer GLP-1s, Ozempic and Wegovy that everybody's excited about, and it goes on and on. Is that really a hopeful picture? It isn't, right? You're going in thinking that this expert is going to give me some advice that's going to change my life, and instead, they're just adding one more bottle into my bag full of pills that I have already. And you look at the MD behind their name and you wonder, this guy must just be a manager of disease because that's all he's doing. I'm here to restore health, but this person is just managing my disease while I slowly get sicker and sicker and get on more and more medicine. What if I told you that there's another possibility? There's a different way. A way in which you are empowered to take your health in your own hands and not be dependent on a pill or an injection or someone telling you what to do and you have no power over the outcome. Wouldn't that be a better situation? Where I'm here to tell you that that's possible, and I've spent the last decade researching and learning how that would be. And it's really simple. It's the power of forks, fingers, feet, sleep, stress, and love. Let's think about that for a minute. Forks, feet, fingers, sleep, stress, and love. These are the 6 master levers of health that really determine 80% of what's going to happen to you in terms of your health. And if you think about it, what happens in terms of your health determines the trajectory of everything else in your life. Because health is wealth, health is relationships, health is the ability to do good things in the world, which is why we're all here to achieve our highest purpose, whatever that may be. And what's really exciting is that the mainstream medical community is realizing what some of us at the fringes have been saying for a decade now. There is now a position statement from the American College of Lifestyle Medicine that presents therapeutic intensive lifestyle change as a primary modality for treatment of diabetes. That means if someone is coming in with a brand new diagnosis of diabetes, while the doctor is supposed to talk to the patient about all the different medicines that they want to take and all the different blood tests that they should get, they should be talking about lifestyle change as a primary therapeutic modality, which means you don't necessarily have to start on metformin, glipizide, insulin, Jardiance, Ozempic. You might need to because your numbers are really drastically high right now. But if you do all these other things, look at what you can do with your forks, feet, fingers, sleep, stress, and love. You might not need that medicine. And what was really exciting was that the last year, the American Medical Association, which publishes the ICD-10 diagnosis codes. Anybody familiar with that? I know some of you are. ICD stands for the International Classification of Diseases, and the ICD-10 diagnosis codes are determining what someone is labeled with as their diagnosis, and then reimbursement and everything else follows. Well, they came up with an ICD-10 code called Diabetes in Remission. That's right. So the mainstream community is recognizing that you can put diabetes in remission. Now, what do we mean by that? Their numbers are normal. That means their A1C is less than 6.5. They're on no medicine. You need those two things to happen before you can say that you've put their diabetes into remission. You can't really say that's reversed because it could still come back, but you can think about it as someone that has breast cancer or prostate cancer. It's in remission, and you have essentially eliminated all the ramifications, all the complications that could happen, and you've made it into a non-issue on the condition that they continue with this therapeutic, much more healthy lifestyle, which is what they should have been doing in the first place, which is the root cause of why they got sick, and which is the root cause of why 60% of our population is sick. We have about half our population is pre-diabetic, and if you include overweight along with obesity, that's 60% of the population, and all the metabolic diseases come with it. I'm talking about diabetes, but that applies to fatty liver, that applies to sleep apnea, high blood pressure, high cholesterol, which translates to younger and younger people having heart attacks and strokes. This is all preventable, and these diseases are really a paper tiger that we shouldn't be that afraid of if we could be informed of how to make those lifestyle choices. How does that sound so far? So let's dig a little bit deeper into the 3 F's, right? F words, but these are nice F words. Forks. What do we do with our forks? We eat, right? But what's the majority of the population doing with their fork? They're stuffing themselves and they're digging their own graves, right? So you can eat to restore health. You can feed, as Payal was saying, you can turn on those genetic and biochemical mechanisms in your body to feed health, or you can jeopardize all that and feed disease. So what the research shows is that the most tactful way in which to nourish your body and stay in a relative calorie deficit is to go with what we call a nutrient-dense, plant-rich diet, which flies in the face of everything that we're hearing from the Maha movement right now, right, where they flip the pyramid and they put butter and steak and chicken on top of the pyramid, and yet they're saying that you should have less than 10% of your calories from saturated fat. So they're a little confused and misguided themselves. But in principle, the healthiest diet remains unchanged, and there's no controversy about that. If somebody says, no, it's the Mediterranean diet, well, the Mediterranean diet is predominantly a nutrient-dense, plant-rich diet. There might be some healthy fish in there or a piece of clean cheese that they might eat, but if you look at the traditional Mediterranean diet, or the traditional diet of the longest lived populations anywhere in the world, we heard about blue zones a little bit from the previous speaker, they were eating unprocessed plants. So we could also call it a whole food plant-based diet. And the cool thing about this diet is that you can eat as much as you want, so you don't really have to limit your calories, but it is inherently a less calorie-rich diet because it comes loaded with what? Plants come loaded with fiber and water, right? Everybody's saying, hey, don't get dehydrated, drink enough water. Well, if you eat plants, you're going to get fiber and water, which will fill you up and not provide you the excess calories that an animal food loaded diet would do. What's the second F? We said forks. The second one was feet. What do we do with our feet? We walk, we move, we want to move the body the way that it's designed to move, right? So 10,000 steps, how many people have heard of this number, 10,000 steps? Almost everybody's heard about it. Well, it's really interesting that when, so anybody know where this came from? Somebody said Japan. Very good, very good. You get some love. Here's a heart. So the number was somewhat randomly picked by some public health authorities in Japan, where they just came up with 10,000 steps. And it's interesting that the research was done afterwards, and it turns out that 10,000 steps is indeed the sweet spot. So if you're doing 20,000, it's actually bad for you. But if you're doing 5,000, you're not getting the full benefit. So 10,000 steps is a really good goal for most of us. And if you look at most of us, we're not really, unless you're deliberately trying to do so, you're not really making the 10,000. I look at myself on days that I'm really busy and I'm walking just maybe 5,000 or 4,000 steps. But 10,000 is a really good number. And walking is underrated. It's a really good exercise. Many of my patients, just by simply walking after every meal, have a blunting of their post-meal bump in their blood sugar by 2 times as much. So if you walked for 15 minutes, you'll see a 30-point reduction in your postprandial blood sugar. So this is easy. Why aren't more of us doing it? Go for a walk. Every time you eat something, walk outside. You can walk outside your house. If you're working from home, you can be on a phone meeting and you can be walking around in the backyard or just going up and down the stairs in your house. And if you add to that some resistance exercise, you're in really good shape. Resistance exercise, again, does not involve anything complicated, joining an expensive gym, spending time to go there. You can do simple body weight exercises like push-ups, pull-ups, squats, and planks. 4 exercises that you can do with your own body weight. And between walking and that resistance exercise that you can do with your own body weight, you're getting most of the benefit that you're going to get from the feet, the second F. And when you combine these two, if you just do these two, you're getting the majority of the leverage that you're going to get from lifestyle is from the first two, which is forks and feet. The third one is fingers. What do some people do with their fingers? I don't think any of you do here because you're at HEALFest. But some people might smoke with their fingers, right? So smoking doubles the risk. This was actually new to me too, that smokers have a higher risk of developing diabetes. And if someone's a diabetic already or has metabolic disease, then it quadruples the risk, it accelerates the risk at which they'll get complications from this metabolic disease. So that's an absolute no-brainer. Smoking. What about alcohol? There's no healthy amount of alcohol, and I like how Mehmet Oz said it when they were presenting the MAHA recommendations, and he says, well, we're not really saying that alcohol is a health food, so definitely don't have it with your breakfast. But to the extent that it's a social lubricant. That was an interesting term that I heard for the first time from Mehmet Oz. That it's to the extent that it's a social lubricant, there may be some benefit, but it's not a health food. So don't start drinking, the 1 or 2 drinks, or start drinking red wine because it has resveratrol if you're not already doing so. You're not going to get any health benefit. So if you're not drinking, don't start. And diabetics instead should be doing something else with their fingers. What's that? Testing, right? So test to know your numbers. And now we have wearables, which are great. We have continuous glucose monitors. We've seen people with the little disc on their arm, or you can wear it on your belly, which gives you continuous readings. But you have to somehow keep track of these numbers, right? You can't really measure, you can't really manage what you can measure, so you have to measure to know what's going on. And it can be really eye-opening because you can see the response to the first 2 Fs. You can see how your own body, your own personal biochemistry responds to eating a certain food, and you can see for yourself whether I'm telling the truth or telling a lie, that if you go for a walk, that number will drop after you eat. So it's really, and so that's a way of empowerment, right? You have the power to see for yourself and take charge of your own destiny. So if you got those 3, you're in pretty good shape, which is forks, feet, and fingers. And the next 3, sleep, stress, and love, I feel like they're the foundation that help you do feet, forks, and fingers, right? Because sleep again, sleep is the master regulator of everything, and it should be a non-negotiable. I know many of us work from home, late hours, after hours, we're on our laptops, we're on our devices, and we switch off, and we get our entertainment from some sort of screen too. And we're not getting enough sleep, whether that's quantity or quality, that messes up everything else. It's harder to make the right choice when you're choosing what to eat. It's harder to muster the strength and the willpower to go exercise if you haven't slept. It affects everything in terms of your psychological health, but also biochemically. It starts a whole domino effect of bad things start happening when we're deprived of sleep. The fourth one is stress. How many people here have ever felt stressed? How many feel stressed on a daily basis? Right? Stress is when we are presented with demands for which we do not perceive that we have the resources to cope with. And what we're talking about here is chronic stress, right? So acute stress is okay if you're getting chased by a tiger and you have to get away, and then either you get away and you go eat lunch, or you become the tiger's lunch. Either thing is going to happen within a few minutes, and either way, that stress is not what we're talking about. We're talking about low-grade psychological chronic stress, which again starts a cascade of unhealthy effects like raising of the cortisol, raising of the basal insulin level, causing midsection visceral adipose tissue gain that makes it more challenging to keep the blood sugars down. So we're talking about forks, feet, fingers, sleep, stress, and the sixth one was? Love. You get some more love. You got two. So love is not this fluffy, feel-good sensation that we're talking about just at Valentine's Day every year. We're talking about feeling supported and connected with the people around us, because we're social animals. And it's more about that social connection, because when we're supported by the people around us to do whatever it is that we're trying to do, to accomplish, we're much more likely to do so. And again, having that social support is a key ingredient into being able to make changes in your habits, which can be difficult, right? This is not easy. So here I'm saying, hey, there's this easy thing you can do, and you can stop all your medicines, and you don't need to see doctors anymore. And I'm doing a little bit of a marketing pitch, because it's not easy to make those changes. But if you're doing it with people that you love, that love you back, it becomes easier. And that's the power of social connection. We know that loneliness, some people are equating to smoking. So the deleterious effects of significant loneliness has been equated to smoking how many cigarettes a day? 15 cigarettes a day. That's almost a pack of cigarettes a day. The same deleterious effects. One of the previous Surgeon Generals, Vivek Murthy, wrote extensively about that. So when you put all this together, forks, feet, fingers, sleep, stress, love, you can reverse the trajectory of disease. Many people can go into remission. I've seen this in my own experience. There are some in the audience that have been participating in the groups that I first started at Kaiser Permanente in 2016. We're almost at our 9th year now. And I could present you with a whole list of people that have done this, who had their A1Cs in the 9s, and now they're in the 6s, and they're off medicine. This is the definition of putting diabetes in remission. And it's been shown in the research too. If you want to look at the research, you can look up the DIRECT trial, D-I-R-E-C-T. The DIRECT trial, participants, about almost 60% of them had remission that was sustained, and these same people had 10 to 15% weight loss, which is what's claimed with the GLP-1 drugs. So isn't this a much better picture, right? Instead of taking more and more medicine, or saying, hey, here's this new injectable that we have, or you can go get bariatric surgery, we can deliver the same results if you start treating your body, yourself, the way that it's designed to be treated. It's really loving yourself right? So then you can take care of everybody else. We're here to achieve whatever it is that our destiny is, our dharma is, our calling is. But the way to do that first is to take care of the body, which is the temple in which we live. So I'll wrap it up here. I would really invite you to think about this, and today, before you leave, make a commitment on which one of the 6 pillars you want to start working on. Is it forks? Is it feet? Is it fingers? Is it sleep? It might be sleep for a lot of us. For me, it's sleep. Is it stress? Is it love? And start that journey today, because the journey of 1,000 miles starts with the first step, and that first step should be today. And that's my invitation to you. Thank you.